Hi, I'm Dr. Eric Hanberg, and this is a forensic pathology fellow case. All of the cases that I'm doing and all of the photographs or sketches that are inside these cases are created with the assistance of ChatGPT, and that means any similarities that exist to real life people or situations is purely coincidental. This is forensic pathology fellow case number 2, the dead of winter. I'm going to give you the case summary, and this is a summary like the one that we would get from our medical legal death investigators. Those are the people that function sort of like CSI, but instead of working for the police, they work for the medical examiner. A 76-year-old woman is found deceased in her clean single story home during a welfare check. A welfare check is when somebody is worried they haven't seen their neighbor, they haven't seen someone that they were expecting to see or hear from, and so they'll notify the police, or sometimes they'll just go over on their own and simply check in on them. At the welfare check, the house is found to be clean and tidy, and it is locked from the inside. There's no signs of struggle, there's no signs of forced entry. And the decedent is found supine, meaning laying on her back, on the couch, partially covered by a blanket with the TV still on. She has posterior bright red lividity. So, lividity again is when the blood stops flowing and sort of settles due to gravity. It creates this bluish, purple, pink discoloration. Notably, the inside of the home is 88 degrees Fahrenheit, and the outside temperature is 20 degrees Fahrenheit. This home is heated with an older style gas wall heater. So, based on that information, I asked for more information. I asked the investigators to go back and look for certain other specific things. To be honest, most of the time, my investigators can tell this type of thing on their own, and they would have asked for these additional bits of information on their own. But it is important that I think of it as well. So, if it's not there, I can ask. So, with the additional investigation, there are no smoke detectors nor carbon monoxide detectors in this home, and there's no odor of gas within the home. The neighbors for this decedent did report that she was, quote, sharp as a tack, and she would often brag about having no significant health issues despite being 76 years old. There were blankets all over the house. So there were blankets on the couch, there were blankets on the chair by the dining room, and there were multiple blankets on the bed. Here are the scene findings, and the most pertinent one is that there was a wall heater on the wall. This old fashioned kind of gas powered wall heater, and there was a sticker underneath it that suggests it had not been serviced in more than 10 years. And pertinent, there's no trauma on the body. Medical history obtained from the decedent's primary care physician. She had a history of hypertension. She was on low dose single agent medication for control of that and otherwise had no medical history, no surgical history, and she had never smoked cigarettes. And it's not on here, but she also did not drink alcohol. At the time of autopsy, her heart was found to have mild left ventricular hypertrophy, meaning the left side of the heart, the larger chamber that actually pumps blood out through the aorta, was a little bit enlarged, and there were no thrombi and no rupture. The lungs were edematous, meaning full of fluid, and congested, meaning blood had backed up into them. The brain had mild edema, and the other organs were again congested, which is a common finding postmortem. Her stomach had about 100 milliliters of tan fluid, and there was no hemorrhage, and there were no pill fragments. Now, the reason I think of pill fragments is essentially to consider the possibility of suicide or accidental overdose. And in this case, there were no pill fragments at all. Toxicology has now come back. I think we were hinting around at it by mentioning that heater so many times. But the important thing here is that there was a peripheral carboxyhemoglobin concentration of 58%. Now, that's certainly too high. And otherwise, the toxicology was negative for ethanol, other medications, and the common drugs of abuse. So now would be a good time for you to pause the video and try to answer these questions for yourself. So, what would the most likely cause and manner of death be? Meaning, on the death certificate up here, on line A, what would you put as the cause of death? And then what would you put that to be due to? So, what would go on line B? And what would the manner of death be? Would it be natural, accident, homicide, suicide, or undetermined? What differential diagnoses were you considering before the toxicology came back? Because certainly that was a concern given the status of the old gas heater and it being so warm in the house. But what other differential diagnoses were you considering? What clues within the house prompted early suspicion of carbon monoxide poisoning? And what clues about the scene in general, about the body, prompted concern? And then finally, I want you to think about the importance of scene investigation, especially in cases without trauma. And for any medical professionals watching, How would you explain this death?
Hi, I'm one of Eric's friends, Dr. Deland Weyrauch. I'm also a forensic pathologist and medical examiner, and I'll do my best to try to give you my opinion and discussion on the very nice forensic pathology fellow case that Dr. Handberg put together about carbon monoxide poisoning or toxicity. Carbon monoxide is a really important, good topic in forensics. A lot to talk about, a lot to discuss, but I did write down some notes to try to make sure I touched everything that Eric wanted to talk about with those questions at the very end of the case. So we'll start with the most likely cause of death and manner of death for this case. I think the death can be entirely explained by the inhalation of those carbon monoxide fumes, but I would phrase this in terms of the injury that would go as the part one cause of death as acute carbon monoxide toxicity for the cause of death. There's some difference there. I understand a lot of forensic pathologists would call this carbon monoxide poisoning for the cause of death. I understand that there's differences. I think that's fine. My rationale for doing acute carbon monoxide toxicity is that I think that toxicity or intoxication is just generally a more neutral term that we kind of can apply to all intoxications or toxicity cases, whether it's, illicit substances, cocaine, methamphetamine, a prescribed drug or an opioid. You could think about methadone, fentanyl, oxycodone, whether it's some sort of drug or substance that causes an intoxication death acutely, or whether it is an exposure like carbon monoxide, a gas, an inhalation of a toxic gas. The term toxicity is just kind of more neutral as opposed to poisoning, which sometimes and in certain states I know right now um, can actually be used as sort of a word with a connotation that means, there was a purpose to it. There was almost like an assassination attempt with a poisoning, fentanyl poisoning, like the distributor of the drug was trying to intentionally cause the person's death. And so some of that politically charged language with poisoning, I think it's just a more neutral term to go with toxicity. But I understand that a lot of health agencies, they're going to understand carbon monoxide poisoning, and they'll view it the same way as an acute carbon monoxide toxicity in terms of sort of for public health purposes, how they code that death. But I would go with acute carbon monoxide toxicity as the cause of death. And for the manner of death, I'd go with accidental for this one, accident, because it doesn't seem like there was any intent. It doesn't seem like the woman, the 76-year-old woman, intended to bring about her own death. It seemed like she sort of didn't know that there was this exposure going on in her house, and with no an injury and no intent, that's how you end up with an accidental manner. After manner and the cause, there's also a section on the death certificate for how injury occurred. And for how injury occurred, is kind of a phrase, and there's a lot of differences with style with the phrasing of the how injury occurred. But I would say how injury occurred for this one would be something like exposed to fumes of malfunctioning gas wall heater in residence. You could say, faulty instead of malfunctioning. Again, there's a lot of stylistic differences there, but I just sort of want to communicate the circumstances of the how injury occurred. It explains the accidental manner. There's no intent behind it. So I'd say that how this death came about was that there was an exposure to fumes of a malfunctioning gas wall heater inside of a residence. And hopefully, with the cause of death, manner of death, and how injury occurred, that communicates just with that death certificate information everything that a reader of the death certificate would want to know that explains the entirety of the death. Um, Now, before we get on to the other questions that Eric wanted to talk about, I wanted to go through some of the details in this case, and a little bit of a discussion behind them. He gave the detail that this woman lived in a single story home. I think that's important because with some of these carbon monoxide exposure related deaths, you could have scene investigation considerations like maybe there's a multiple story home and maybe there's something like a portable gas generator that's being used in the basement, but the body is actually unresponsive on a couch upstairs or on one of the upper floors. So maybe if you're too hyper fixated just focusing on the body and what's immediately in the vicinity of the body, you might overlook something like in the basement is where the actual source of the exposure is coming from, the portable gas generator in the basement and not even close to the body, but still within that confined residence. Also, that the decedent had bright red lividity. The liver mortis was distinctly described as being bright red. Oftentimes in forensics, when we talk about carbon monoxide, we talk about cherry red, bright cherry red liver mortis as being a distinct color of the body after death. It's important to note that this is not necessarily specific. Bright cherry red type lividity is not just a carbon monoxide exposure thing. You can get it with, I think, classically the textbook things, something you might get on like a test question, are cyanide exposure or cyanide toxicity, hypothermia, but not just hypothermia that occurred as a cause of death or during while the person was alive, but even the cherry red discoloration from uh, refrigeration, just artifactual refrigeration of the body after death can give you a cherry red lividity too. But even just things like a prolonged postmortem interval. If the body has been deceased for a while, there's starting to be some green discoloration to the body for things like putrefaction. The green discoloration often goes along with areas that aren't putrefied and green, can look more cherry red in the areas where there's blood pooling postmortem and lividity. So if you get like a test question and cherry red discoloration of the lividity is involved, it's usually something like hypothermia, refrigeration, cyanide or carbon monoxide, or maybe putrefaction or a prolonged postmortem interval. That she was never a smoker. Eric said in the case description that this a woman was never known to smoke cigarettes and was never a smoker. This is important because when you're looking at the test of carboxyhemoglobin concentration, it was mentioned that her peripheral blood CO or carboxyhemoglobin level came back at 58%. This is important to note because people who are chronic smokers can have they can walk around day to day with elevated carboxyhemoglobin levels, 8% to 10%. Usually 10% is kind of viewed as like that threshold that, if you're a really heavy chronic smoker, you can be walking around with a carboxyhemoglobin level of 10%, whereas most people might be, 0, 1, 2%, 3% maybe. If you're above 3%, you probably smoke to some degree. That gets into the important sort of thresholds when we're looking at that carboxyhemoglobin toxicology test and the information that it's giving us. So typically, if you're not a smoker, you shouldn't be above 5%. If you are a chronic smoker, you can be up to 10%. Once you get above 10%, we start to view that as being evidence of some sort of exogenous, outside the body, coming into your body, inhalation of fumes that is basically a carbon monoxide poisoning. Um, Once you get above, especially like 15%, over 15%, then you're starting to get symptoms. And specifically important to note for things like medical history, social histories, when you're considering a CO exposure, is that above 15% carboxyhemoglobin is when most people start to uh, describe things like flu-like symptoms. So if you start to hear that someone had flu-like symptoms, just think about what you know to be flu-like symptoms, but that they can be seen with carbon monoxide intoxication above 15% CO levels. Now, above 30%, that starting to be viewed as like a severe carbon monoxide exposure to the extent that above 30%, severe toxicity verging onto possible coma, seizures, arrhythmias, death. What's typically viewed as being like that sort of lethal concentrations of carboxyhemoglobin, 40% and above in healthy individuals, 40 to 60% usually in healthy individuals is when people die. The case example, her carboxyhemoglobin came back at 58%. Now, healthy individuals can have higher, 68%, 72% inhalation, but what's really nice and in forensic pathology, a lot of us expect the carboxyhemoglobin test to kind of do a lot of work for us above and beyond what we expect of a lot of other toxicology tests. For example, uh, with tolerance. So you can't really, be chronically exposed to carbon monoxide and get a tolerance such that you're going to be walking around, conscious and talking and living your life at a 58% CO level. That doesn't happen, as opposed to something like fentanyl, where if you are a chronic user of fentanyl, you can get a very substantial tolerance to fentanyl, such that um, you can be walking around with levels that would kill another person who is naive to the fentanyl drug. Someone might use fentanyl for the first time, get to a level. that you're very tolerant to, but it causes them severe toxicity and death at a fentanyl level of some nanograms per milliliter. But if you use it chronically and in heavy amounts, your body can develop a tolerance to fentanyl, and you can walk around at that level. That's not the case with carboxyhemoglobin, which is very useful to medical examiners, because if we see someone with a carboxyhemoglobin level of 52%, we go, okay, that person was alive when they were exposed to that carboxyhemoglobin, when they were exposed to that carbon monoxide. And that carbon monoxide is mechanistically the cause of death or playing the major role in the death. But it's important to note that we don't want to over rely on the carboxyhemoglobin test to give us that answer to the cause of death. And I think about this mostly with things like when people intend to bring about their own death, particularly using like a motor vehicle. So if a person is, they close the garage door after pulling the car into the garage, the keys in the ignition, they left it on. When the body's found, there's no gas left in the tank, and it's in the keys are in the on position in the ignition. Maybe they left a note of their intent to end their own life, etc. Um, Whether it's that, whether they route some tubing from the exhaust port into the window, and they roll up the window and duct tape everything shut. The person clearly intends to sort of bring about the end of their own life with the carbon monoxide exposure from the vehicle fumes and the vehicle exhaust. We often expect, like, okay, the only thing that we're going to find when we do that person's autopsy might be, that we're sending out that tube of blood in the green top tube for the carboxyhemoglobin level, and we're just hoping that it gives us, a 60%. But it's important to note that with modern vehicles, things like the catalytic converters can be so efficient and so good. They can essentially, carbon monoxide comes about because of what I think about as dirty combustion, incomplete burning of carbon based fuels. So, this is why you get carbon monoxide with things like charcoal grills and these gas related generators, vehicle exhaust, things like that. It's kind of a dirty combustion or an incomplete burning of fossil fuels and carbon based fuels. Uh, but with catalytic converters, if those are so efficient and good at reducing the carbon monoxide that comes out of the car, it's not uncommon nowadays to have these types of situations where the carbon monoxide level, the carboxyhemoglobin level in the person's blood from the tube of blood you sent out from the autopsy might not be elevated. And that's because that catalytic converter is so good. But there's all sorts of other things in vehicle exhaust that you're not supposed to be breathing in. They're still toxic to you. It's just that we're looking at that very specific byproduct of the combustion of carbon monoxide to do all the work for us. But if the catalytic converter is really good, it might not do all the work for us because it's the other components of the vehicle exhaust or even the exclusion of oxygen in that confined space that brought about the asphyxia and the person's death. And the carboxyhemoglobin is actually not elevated. So, again, important thing to consider for these cases where you're really considering the carboxyhemoglobin and the carbon monoxide exposure as the cause of death, that in that particular case, because of modern vehicles, you might not be able to fully rely on that carboxyhemoglobin test. I mentioned there was going to be a lot of cool, interesting stuff about CO, right? I got to get moving here. So let's get on to Eric's other questions. Number two, the differential diagnosis that you would have had before those tox results came back. So in this case, just a couple of very specific things I was thinking based on the circumstances and the autopsy findings without those tox results. So hypertensive cardiovascular disease, you've got a 76-year-old woman who's found unresponsive in her home without trauma. And that was as a response to a welfare check. So, you basically have a sudden, unexpected death of a person who was reportedly or purportedly previously healthy, living in her normal state of health, welfare check, unresponsive in their home, no trauma. So that's, you're often in someone that age, you will be thinking about things like arteriosclerotic or hypertensive heart disease, cardiovascular disease, as being the differential diagnosis for the cause of death, as well as other intoxications, right? Maybe she did intentionally use some sort of drug. Maybe she was using an illicit substance. You never know anymore. You get 60, 70 something year old people nowadays who are still using methamphetamine or cocaine or, stimulants, illicit stimulants. Maybe it was a different drug that brought about the death, which is why you have, again, no trauma and essentially an unremarkable autopsy other than some heart disease with a sudden death in a residence. And then maybe a third thing to throw on there would be some other environmental exposure. You've got this scenario of the 20-degree, outdoor temperatures with the 88-degree indoor temperatures, very hot inside, but very cold outside with the blankets strewn all around. Maybe there is some sort of either hypothermia or hyperthermia situation going on with her. Although, given the entirety of the circumstances, I think that's a lot less likely in this case. Number three, clues to the clues at the scene investigation to suspect the carbon monoxide as being the potential cause of death. So again, that bright red lividity that she had, or the cherry red lividity that you might see or hear about, in an elderly individual who's just seated on her couch in her home. So maybe that discoloration to the lividity tipped you off to consider carbon monoxide toxicity. The discrepancy between, again, that indoor temperature being 88 degrees, like basically this blisteringly hot, uncomfortable level of heat indoor temperature. Most people don't like to have the heat cranked up to be 88 degrees on their like thermostat in their house. People, it's like sweltering. People usually tend to be, like 65, 70, maybe 73 or even 75 degrees, but 88 is like uncomfortably warm indoor temperature. Meanwhile, the outdoor temperature is below freezing. It's 20 degrees outside. So that kind of gives you this suspicion that there's probably some sort of malfunctioning um, heating system in the house. Like something's probably broken that is leading the indoor temperature in that house to be 88 degrees. Because it's just an uncomfortable temperature. Heating system, something's off. A ventilation duct is plugged, or something's broken leading to be that 88-degree indoor temperature. Blankets strewn all around too. Maybe there's some malfunctioning to this gas wall heater. And that's the other thing with the scene, is that he emphasized that there was this sort of old, out of date almost gas wall heater that hadn't been checked on in like 10 years. Again, anything that's sort of a malfunctioning or potentially malfunctioning gas related appliance, maybe there's a gas leak, a water heater, a portable generator. What you really want to think about and consider CO exposures are like also in like times when there are brownouts or like wide scale um, loss of electricity to like multiple homes, and then people get out their portable gas generators. That's when you really want to consider carbon monoxide toxicity as being a cause of death with sort of very cold outdoor environments, and there's these wide scale sort of outages of electricity. People bring out the portable gas generators, and you can get some of these accidental carbon monoxide deaths. Also, that there were no CO detectors in the house, and even though there was no odor of gas, remember that carbon monoxide is a odorless, colorless, tasteless gas. Number four, the importance of scene investigation in cases without trauma. So I think what Dr. Hamburg is getting at here, when you do not have trauma, the scene investigation can play a much more important role to find indicators at the scene that can help you decide how to work up the case. Something else that's important about carbon monoxide and carboxyhemoglobin testing, not an automatic test. We typically will draw a tube of blood from our decedents in gray tops, and that gray top is what we'll send off to the toxicology lab. They'll look for routine drugs of abuse, different types of prescription drugs, when we sort of do routine toxicology. But carboxyhemoglobin is not really, and I think in a lot of offices, routine toxicology testing. You might have to order it specially because with the way it's tested for is oftentimes co-oximetry. They need that green tube of, the tube of blood that's with the green top and not the gray top. Green top gets the co-oximetry. A lot of offices will have point of care sort of testing they can do on the same day, so they don't have to wait for the results for the carboxyhemoglobin level, because having that level at the time when you do the autopsy can be really beneficial in something like if you're looking for it in terms of a smoke inhalation from something like a residential house fire, it can tell you whether they were alive during the fire or not. Also, if you have something like maybe you have someone dead in a hotel room, or maybe you have multiple people dead in the same hotel room. And if you test, draw some blood, send it off in the green top, get it tested that day, the same day of the autopsy, and it comes back with elevated carboxyhemoglobin, you might have something like a public health threat. Maybe you have a malfunctioning heating system in a hotel room that is emitting carbon monoxide leak into a hotel. Maybe they even are considering checking other people into that same hotel room or into the building where that hotel is. You might have a one of the very rare sort of critical values for a laboratory result in forensic pathology. If you have an elevated CO level in a decedent who was in sort of a public housing, an apartment building, a hotel building, where you could have a carbon monoxide leak that isn't threatening the health and the safety and the lives of other people exposed to that similar carbon monoxide gas exposure. Because carbon monoxide or carboxyhemoglobin is not um, always routine testing, the scene indicators might give you the clues that help trigger the ordering of the carboxyhemoglobin level. And you could miss a carbon monoxide death if you don't have those scene indicators or you're not already thinking about it. And so often you do not have findings, or may you only have non-specific findings with autopsies in any toxicology related death. It's very rare actually for toxicology or drug related deaths to give you specific autopsy findings. Oftentimes they're very non-specific, or you have no findings at all, and it is the results of the toxicology testing that give you the answer in terms of the cause of death when you have no trauma at autopsy. Especially because the natural disease findings, things like large hearts, coronary atherosclerosis, these sort of heart disease findings are oftentimes fixed. And you go like, oh, I found no more compelling cause of death than their heart disease. This is probably a sudden heart-related death. But if you didn't know to order that carboxyhemoglobin testing, it might never be done, and you might just completely miss it. You call it, atherosclerotic cardiovascular disease, but that's only because the carboxyhemoglobin testing was never performed. So that's why scene investigation can be so important in these cases, and not just with drugs, but also other environmental exposure related deaths like hypothermia or hyperthermia. Um, those also tend to have either non-specific or absent autopsy findings. And again, it's this really the circumstances and the scene investigation that gives you all the clues to do the proper workup and the proper consideration of whether there was something in the environment that brought about the person's death that you couldn't find just with the autopsy findings. This sort of, what you see with your eyes and feel with your hands, and the information you have just from the surgical aspect of the autopsy procedure. And lastly, to discuss an explanation to the decedent's family of how this death came about. If you had this death, you were the medical examiner, the family wanted to know about it, how do you explain it to the family? And like Dr. Handberg has said, Dr. Handberg talks about a lot of stylistic differences in communication with families. This is how I do it. You might have a different approach, but I would not get into the specifics of right carbon monoxide toxicity, right? Because it has to do with the carbon monoxide having such a higher affinity for hemoglobin than the oxygen, and it just kicks the oxygen right out the hemoglobin, and then you chemically asphyxiate because your liver and your heart and your brain can't get oxygen. I wouldn't get into any of those specific details. I would keep it general. I would say, there appeared to be this broken gas wall heater in the house that wasn't working properly. That leads to the carbon monoxide fumes building up in the house. Carbon monoxide is this colorless, odorless, tasteless gas. And exposure to this gas is highly dangerous because breathing it does prevent, generally it prevents the body and the organs from using oxygen properly. And obviously, all the organs need oxygen. That's why we breathe. But I think something specifically for carbon monoxide toxicity and communication with families is that sometimes this topic of pain and suffering comes up, and we can't always say, we have the body after death. we can't always comment or know the pain and suffering that people experience in the various ways that people die. Sometimes we have to remain essentially agnostic as the medical examiner about pain and suffering. But there are circumstances in certain types of death where maybe we can comment when we're communicating with families. And I think luckily this is one of them. I think with certain deaths like opioid or sedative related intoxications, where people essentially, you know, become more and more obtunded is the word, but it's almost with sedative related intoxication deaths with things like opioids, people essentially fall asleep and don't wake up. They fall asleep until they die. That's sort of the evidence that we have for mechanistically how these deaths work. And, in the rare instances where these deaths have been actually um, caught on video, we kind of see how people die when they die with things like sedatives. They essentially nod off and become less and less responsive. They don't suddenly collapse. They're not yelling. They don't appear to be in pain or struggling. They kind of nod off and fall asleep and don't wake up. And with carbon monoxide, this is probably similar um, to how people die. Is kind of this slow, less and less responsive chemical asphyxiation, and something we can use when we're communicating with the families as to why we might believe this to be the case, with this being a more or less painless death that doesn't involve a lot of suffering. Is look at the scene, right? These people can just be unresponsive on their couch with the blankets on them and the TV still on, and it really looks like they might have just napped or fall asleep and never woke up. I've personally seen cases like this where there were actually multiple decedents in the same house because there was something like um, leaving the car running in the enclosed garage, but then the decedents, the people who died, are on the couch in the living room. It's because the car was running in the garage, but the garage was enclosed, and the fumes went into the rest of the house. But it's like both people. You have two people who are essentially. It looks like they are asleep on the couch in the living room, and they're both positioned like that. And that's another thing to think about with carbon monoxide deaths is if you have multiple decedents in the same house, in the same room, both without trauma, definitely consider a common, the commonality of a carbon monoxide exposure in those cases as to why two people are dead with no trauma in the same room. Think about carbon monoxide exposures. You tell the family, for these reasons, I do not think there was a lot of pain and suffering that went along with this death. It looks, based on the scene, based on what we know about these intoxications, that it was essentially maybe like going to sleep and never waking up without lots of pain and suffering. So that specifically is something to consider in communication with families about these cases. So um, that was a bit of a discussion, but I think carbon monoxide is really interesting and an important topic in forensic pathology and as medical examiners. And I hope you enjoyed this case that Dr. Hanberg put together. We'll see you for the next forensic pathology fellow case. Thank you.